For Elsevier Global Medical News, I'm Heidi Splete, reporting live from Washington, D.C. I'm here with Dr. Nora Volkow, the Director of the National Institute on Drug Abuse, at the release of the findings of the 2008 Monitoring the Future survey.
Physicians, whether they are general practitioners or pediatricians or specialty physicians like psychiatry or neurologists, are in a unique position to actually screen for drug use, and in screening can be able to detect whether someone may have started to initiate drug use or whether in fact they may already be regular users. And they are in a unique opportunity to do an intervention that could shift in such a way that it could prevent further drug use in ways that otherwise will not happen. So because there's a high proportion of kids that at one stage or the other are going to go through a medical examination, the medical community could make an enormous impact in the prevention and treatment of substance abuse. Unfortunately, most physicians feel very uncomfortable asking questions about drug use, and they don't actually even know how to do it, so in many instances they won't even ask, and that's a terribly missed opportunity. And it's not just a missed opportunity in terms of the prevention of substance abuse, but also in terms of good medical practice, because the use of many of these substances, whether it's legal or illegal, can actually contribute to the morbidity of diseases. Say, for example, you may have a kid with asthma, and if you are not asked if this kid is smoking marijuana, well, you may not understand why that kid is deteriorating or not responding to medication. The same thing if the kid is taking cocaine, which is a medication that's going to basically have an interaction effect with the anti-asthma medication. Well, it's not going to be any surprise that that kid's response to the anti-asthma medication is not a good one. So it makes sense from both perspectives, from good medical practice, but also from the opportunity to do an intervention that could be preventing vis-a-vis the later initiation of or development into drug addiction.
I'm joined by Dr. Lloyd Johnston, the lead researcher on the Monitoring the Future study on drug use among teenagers. Dr. Johnston, what was the most surprising result from this year's findings?
I think the most surprising really had to do with tobacco. We had thought a couple of years ago that the decline in smoking among American teens had leveled off and was ended. But last year in this, we actually saw a decrease in smoking. So the decrease is now continuing. I think that's very important because it's going to have major implications for the health and longevity of this generation.
Thank you so much, Dr. Johnston. For Elsevier Global Medical News, I'm Heidi Splete.